I'm Kristina Knickerbocker. I'm an Air Force veteran that served at Wright-Patterson Air Force Base for a decade. I'm a nurse practitioner and I'm a mom, and I'm running for Congress against corrupt career politician Mike Turner. Today, on Women's Equality Day, the anniversary of the passing of the 19th Amendment, we celebrate women having the right to vote since 1920. But today is also a day to remember we have a long way to go to fight for equality for women. I'm surrounded today by nurses and advocates and community members who are here to hold Congressman Mike Turner accountable. He has a record over the last 3 decades that have consistently failed women across this district and the country. It is impossible to capture all the ways Mike Turner has failed women, my patients, and this community, but I'm going to try. Mike Turner has refused to sign the petition to release the Epstein files. It took multiple Republican colleagues to sign on, yet he still did not. It wasn't until 217 of the colleagues stepped up before he was willing to vote to release the Epstein files. When I'm elected to Congress, I will be fighting for an unredacted release of the Epstein files because no one is above the rule of law. Mike Turner stayed silent as Max Miller faces active abuse allegations. When Mike Turner was directly asked on national television whether House leadership should investigate domestic abuse allegations against fellow Congressman Max Miller, Turner refused to answer. When given the chance to simply say abuse allegations deserve to be taken seriously, he chose deflection instead. Silence is a choice. For a member of Congress representing women across this district, his silence is offensive. As a survivor of domestic violence, Mike Turner's silence and behavior perpetuates unsafe environments for survivors to not come forward out of fear. Mike Turner voted to cut billions of dollars from feeding hungry children and providing affordable health care to families. Turner voted for the one big, beautiful bill. That is why I'm standing here today. Mike Turner is now deciding between life and death. He has cut nearly $1 trillion from Medicaid across this country and nearly $300 billion from SNAP across this nation. As a nurse practitioner, I tried to warn Mike Turner how his votes would kill my patients. He did not care. He chose to cut funding that is supposed to keep my patients and community healthy. I've spent my entire career taking care of this community. I've taken care of veterans, active duty, military families, and my patients across this community, state, and country. They continue to suffer because Mike Turner continues to vote against them. I hear every day how his votes continue to make resources from this community continue to make life harder and more expensive. People are sick and tired of working so hard and not being able to make ends meet. He voted to defund women's health care. He has cut Medicaid. And women have less access to cancer screenings, contraception, basic reproductive health care for women who rely on these services. Mike Turner, again, is making life and death decisions. Moms and babies are dying at unprecedented rates in this district. When legislation is brought up to help solve these issues, Mike Turner is nowhere to be found. The Black Maternal Health Omnibus Act, the legislation to address the U.S.'s maternal mortality crisis, which disproportionately impacts Black women, has been introduced repeatedly to Congress. Turner has chosen to never sign on and co-sponsor, even as our state ranks as one of the worst in infant mortality death and maternal mortality death across this country. Turner has voted 63 times to keep healthcare from being affordable for this community. His recent vote against extending the ACA tax credits continues to rise healthcare premiums across this district, making healthcare unaffordable, where people have decided to choose not to insure themselves because they simply cannot afford it. Hundreds and thousands of Ohioans are going without health care today, and that number continues to rise because of Mike Turner's votes. It is time for this district to have someone who fights for pay parity, protecting the right to vote, creating affordable, high-quality child care access, and affordable and accessible health care for women. On a day meant to celebrate women's equality and make sure we continue to fight to make sure women have access to the resources they need to live and survive. Mike Turner's record shows us a pattern of silence, inaction, and votes that hurt women and families in this district. Today, I'm asking Congressman Mike Turner a few questions. Do you support Congressman Max Miller or the women and child he's accused of abusing? Will you fight to fully release the Epstein files or keep protecting the rich and powerful Epstein class? Will you fight to restore SNAP funding, feeding hungry children? Will you fight to reinstate these Medicaid cuts? Or will you keep taking food and health care away from my community? Will you fight to fund women's health care, cancer prevention, pediatric cancer research, or let Ohio continue to lead in infant and maternal death? Will you fight to lower our health care premiums, or let Ohioans go uninsured and let people die? I know my answers, and I'm not afraid to speak out. That's why I'm running for Congress, because this district deserves a voice who will not stay silent. Thank you.